Good afternoon, everyone. That's better.
Yeah.
Good afternoon. On behalf of everyone in the Mountain Health Network, I would like to welcome all of you to St. Mary's Conference Center. Today is our formal introduction to Mr. Michael Mullins, Mountain Health Network's President and CEO. It is wonderful to see so many physicians, business and government leaders, and healthcare leaders with us for this special occasion. As we begin every event here at St. Mary's with prayer, I would like to ask you to pause with me now as we bow our heads. Lord, our time here this afternoon is marked by rich and meaningful conversation as we welcome Mr. Michael Mullins to our region. We ask you to impart your blessing on Mr. Mullins as he leads our newly established healthcare system, as you have brought us together as healthcare, community, and state leaders. We ask that you guide us as we desire to grow in understanding and commitment and serve the people in the tri-state area. We ask this in your holy name. Amen. Coming to the podium in a few moments, we will hear from the chairman of the board for Mountain Health and Cabell Huntington, Dr. Kevin Yingling, as well as Dr. Joseph Shapiro, Dean of the Marshall University's Joan C. Edwards School of Medicine, and Mr. Mullins. But first, we will hear from Mr. Gary White, who most recently served as interim president and CEO of Mountain Health, and also helped lead us in the search for Mr. Mullins. We are grateful for Mr. White's leadership and insight over the past several months, and he will continue to play an important role in the Mountain Health as an advisor. Mr. White.
Thank you, sister, and good afternoon. Welcome to a great celebration. It's been my privilege to be the interim CEO of this newly created healthcare system for the past year. And if I could take just a moment of personal privilege, I'd like to offer my sincere thanks to everyone on the staff of the two hospitals, the community at large. You've been so kind to Joanne and I in this assignment over the past year or so, and we are very grateful for that. And we look forward to watching this healthcare system grow to be the destination for healthcare in the state of West Virginia under Mike Mullins' leadership. I would like at this time to recognize our government officials who have been kind enough to join us today. And when I call your name, if you would somehow acknowledge your presence, I would appreciate that. Councilwoman Carol Poland is here. Carol? Thank you. Councilwoman Jennifer Wheeler is here from the city of Huntington. Commissioner Kelly Sabonia from the Logan County, I'm from Logan. You know how we run elections in Logan, you can't get away from that. Cabell County Commission. Right there. Thank you. On the very front row, our newly elected Congresswoman and my landlord, Carol Miller. And while we enjoyed significant support from our politicians and our government in our pursuit of putting this organization together, we are delighted that the Attorney General, Patrick Morrisey, is here with us today on the front row as a person who played a significant role in causing this to happen. General Morrisey, thank you and welcome. And finally, we have Delegate Evan Worrell with us. There he is, right there. I also have been asked by Senator Manchin to read a written communication that he has provided for Mike. It's my privilege to welcome Michael Mullins as the first president and CEO of the Mountain Health Network. Comprised of Cabell Huntington and St. Mary's hospitals, the newly created Mountain Health Network reaches a service area of millions of residents in 23 counties in West Virginia and the tri-state area. Mr. Mullins brings with him a wealth of experience, including more than 30 years in hospital leadership, as well as 28 years of service in the U.S. Naval Reserve's Medical Service Corps. He's an outstanding leader, collaborator, and mentor, and I'm confident his vision for the health network will move healthcare in this region forward in a remarkable way. Again, I am honored to congratulate Michael Mullins, and I look forward to witnessing the exceptional growth of this outstanding institution under his leadership in his new role. With warmest regards, Senator Joe Manchin. It's hard to believe my notes say 10 months ago, but I, along with Dr. Porter and Jim Bales and several others in this room, remember trips to St. Louis in mid-year 2014, when these negotiations and the life of this transaction actually began. And it's hard to believe that in May of this year, with the help of many that I've already recognized, we were able to complete this transaction, which I believe will be, as is typically said, a game changer, not only for healthcare in our region of West Virginia, but a game changer for the Huntington and metropolitan area of Huntington. As we brought together teams from the two hospitals, our first major task was to get this new system on solid financial footing. And we created a team from the two hospitals and employed expert help from the financial community to travel with us to New York City. And while there was a lot of apprehension about what you might do when you're making a presentation for the first time in front of the financial rating agencies, I can tell you that our folks did an outstanding job. And all they did was go there and tell our story, tell our vision, and do it with a level of conviction that was extremely effective. Normally, in a hospital merger situation, as I understand it, as it relates to the financial world, you could expect a slight downgrade. Not only were one agency left our rating as it was, the other agency gave us a slight upgrade. So I think it's fair to say that our team did a good job, but more importantly, that the story and the vision that we put forth to those individuals was believable and resulted in the solid footing we were looking for. Since then, we have begun and continue to make progress with population health, with our new accountable care organization. We've had 2 healthcare summits in this room. We've unveiled the PROACT program that you're probably familiar with, that is a significant player in the treatment of the opioid-related issues that we find in our community. We've created the fundamental elements of the system's mission. Once again, we brought folks together from the 2 hospitals to talk about what the mission of the system should be, and they came up with a new inclusive mission statement, and that's our guiding principle today. We established several working committees. Some of those committees looked at what I termed low-hanging fruit. Let's look at those things that are almost common sense that we ought to be talking about. St. Mary's is paying $2 for something and Cabell's paying $3. Why are we doing that? Now, together, shouldn't we pay something less than $2? And guess what? It worked. and we're already starting to see the impact of that work. At the same time, we brought together medical professionals in the disciplines of cardiovascular care and pediatric care, and our process is well underway to create a center of excellence in cardiovascular treatment and also in pediatric care. So cooperatively, we are getting our work done. That's something I hear Mike say quite frequently in the 13 days he's been here. Let's get our work done. We're getting our work done. Along the way, we entered into an affiliation agreement with the Charleston Area Medical Center. We're exploring ways as to how and why we can't work together to improve health care in the southern region of the state, and I think we will. As Dr. Yingling and some of the others in the room will appreciate, we went through a rigorous naming process for the system. We're all laughing because it was a rigorous process, but we are officially here today as Mountain Health Network. And finally, I was tasked to bring folks together to create a search committee and find our new leader. Believe it or not, we began that process on September the 1st. The search firm was in Huntington on September the 4th, and by December 31, we had selected and were in the final days of negotiation for the employment of Michael Mullins as our CEO. That's quite an accomplishment, and my hat is off, and my hair, to our search committee. A lot of hard work. We had a great search firm. We had great candidates, and the process worked. I remember once we had started to evaluate the finalists, I remember a comment that our representative from Korn Ferry made, and that was this: that when they interviewed Mike Mullins, and I'm talking now about the search firm interviewing, when they talked with him about this opportunity, at one point he described it as his dream job. And you know, when you're looking to bring someone into a new system and to a new area, that's really the kind of, those are words you want to hear. They want to be here. They understand the opportunity and the value, and certainly, Mike Mullins came to us with enthusiasm. Melissa's now here with him, and we are delighted that they have chosen Huntington as their new home. Finally, as I said, Mike's all about the work. Mike, welcome. We look forward to your leadership. We look forward to the benefit of the experience you've already brought, and it's a pleasure working with you, and we wish you every success.
Good afternoon. I just want to take a good look at this really wonderful audience. All of you, in my opinion, are friends of healthcare in Huntington, West Virginia. And today is a really big milestone. I have stood in front of many emblems in my lifetime here, and I'm proud to stand in front of this name and this emblem, Mountain Health Network. It's a really positive day for Huntington. It's a really positive day for healthcare. I would just add to that, like many of you all, I have been employed by St. Mary's Medical Center for 40 years. I've been employed in one way or another by Cabell Huntington Hospital for more than 40 years. It is a really good day that we are a unified healthcare system in Huntington, West Virginia. I am pleased to welcome Michael Mullins as the Mountain Health Network's permanent CEO. Mr. Mullins has experience in leading healthcare systems to success through strategic priorities such as growth, quality, patient experience, and financial performance. Further, I really do commend the board selection committee and interim CEO, Gary White. Their clear, focused dedication and commitment to this process has brought us an outstanding leader. It has been my privilege to work with an outstanding group of talented individuals who care very much about healthcare and about healthcare future in Huntington, West Virginia. As the board and the search committee began their search for a system CEO position, we knew that the system deserved someone truly unique. I would also preface that we knew that we needed to choose leadership qualities that had been demonstrated by many of our leaders in the past. You will know those leaders, those CEOs, like Mr. Smith, like Mr. Soltis, like Mr. Jones, like Mr. Marsteller, like Mr. Sellers, like Mr. Fowler, like Mr. Campbell. There are many features about those leaders that this board and this selection committee wanted to capture in the next leader for our system. A leader, if you will, the leader needs to have these qualities, which I believe Mr. Mullins has demonstrated. He aspires people to follow that vision that was expressed by Mr. White. He has a passion for learning and teaching. He has a true philosophy about mentoring others and raising them up to the best they can be. He is balanced with humility to admit that others could actually have expertise. He is willing to be bold, to tackle challenges, to have a can-do attitude. He is willing to be a good listener, and he empowers others to do their best. In short, there's a quote from a famous person of leadership. Leadership is the capacity to translate vision into reality. I sincerely believe we have a leader that can translate the vision that we have placed before him into reality. Friends, we have found that leader in Mike Mullins. Mr. Mullins is driven to provide our region with the benefits of improved quality care, to improved access, and to affordability. He brings the experience, the expertise, and the inspiration to build Mountain Health Network to make Huntington a true healthcare destination. Mike, welcome to Huntington. Welcome to our healthcare system. Please join me in a few minutes to welcome Mr. Mullins to his new position. It's now my privilege to welcome to the podium the Dean of the Marshall University School of Medicine, Joe Shapiro.
Thanks, Kevin. Mike, if you feel challenged by the responsibility, I'm following Dr. Charles McCown, who was dean for 25 years. I've been dean for 7 years, and I'm still the new dean. The formation of this network is an incredible opportunity for the community, for the medical school, for the institutions participating in this merger, for the population of this region. We're really, really excited about what this can bring and will bring and is already bringing to our community. The saying goes that victory has 1,000 fathers and defeats an orphan. Well, there really are 1,000 fathers for this. But I want to take a moment and remember that many people really did participate in the development of this merger. Steve Kopp, our late president for Marshall University, envisioned this and set up a number of meetings of people with Mike Perry, who was an architect of this. Gary White participated. No one really more than Brent Marsteller and Mike Sellers, who, coming from competing hospitals, managed to find a way to see the beauty and the strength of bringing these organizations together. It's a very, very exciting time, and I think that this is going to be terrific for the community in the future. identifying a leader for such a system is a humbling thing. And among Mike's many, many attributes, he's been incredibly successful in his previous jobs. He's done enormous jobs with corporations of billions of dollars of revenue under his protection. And yet he's a humble man. He talks of his military service very, very proudly but reluctantly. He doesn't speak highly of himself. In fact, one of the questions that I ask all the applicants, I like to ask applicants to describe their greatest failure, right? And you get different answers. You get some people who tell you, failures? What are you talking about? I'm here applying for this big job. I don't make mistakes. I mean, failure? What are you talking about? Mike began his answer with, where do I start? He's a truly humble man. He's going to be a great, great leader for our network. I couldn't be happier. Let me have the pleasure to introduce Mr. Mike Mullins.
Well, good afternoon. Thank you so much for that reception. I'd like to first begin by saying to Sister Mary Grace, Dr. Ewing, and Dr. Shapiro, and Gary White, thank you for your comments. It's very kind of you, and I appreciate the welcome that you've given me. To the community, and to the board, and to the selection committee, I think one of the things that helped was the welcoming that you gave to Melissa. It was a nice experience for us, and the Ladies Auxiliary, the Philanthropy Committee made sure that she had something to do on our weekend. And she quickly went to Milton to buy glass, and we learned quickly what's important locally. So thank you for that. To our boards who are on the selection process, and I'm just now getting out to meet them, the one thing that really caught my attention was the ability to have a candor, straightforward conversation with them. I can come across as being very direct, but it's just because I just want to be transparent and just want to get to the point. And the selection committee responded well to that. And I know I remember Dr. Shapiro and Gary and the folks that were on there. That was the fastest 90 minutes of my life. It went by that quick, and they saw the real me during that 90 minutes, and they surprisingly invited me back. So that's a good thing. So far, Dr. Yingling, you have been a great guidepost. You have been a good counsel so far, and we're just getting started. But I look forward to that partnership and working with the Mountain Health Board, all our boards, and our medical staff. I'd like to make a comment about the teams. That is ironic that would happen. You just can't script that, can you? That's a Kodak moment. When in doubt, call Gary. That I have learned. I got that down. Okay, Dr. Shapiro, just add that one to the list of failures. Didn't turn off the phone. To the hospital teams that I've met so far, to get to this point, under the scrutiny and under the pressure and under all the efforts to get to this point is just a remarkable statement of achievement. Todd and Kevin down the stretch have led their organizations extraordinarily well, and I would be remiss if I did not pay a compliment, and I don't know these gentlemen, to Brent Marsteller and Mike Sellers for the fact that they were willing to lay down arms to try to have a conversation about a better way. I tried that in a couple other communities, and I could just never get my peer across town to accept the fact that maybe in troubled times of healthcare, we could be stronger together to navigate the waters than try to go down that road alone. Because in time, especially today in healthcare, more and more small, freestanding rural hospitals are closing because they can't make it on their own. And that definitely is not going to be in our future. And I think our board has made that very clear That's not how we're going to end up when we're through the other side of our transformation. I'd like to thank, to get to this point, Dr. Gilbert and Marshall University, a great host during my interview, a time to get to meet the community and to get to meet some of the leaders, and was extraordinarily welcome. And then as I've begun the first 13 days on my job, thankful to the physicians at Marshall Health. They've already invited me in to help educate me. That's what educational institutions do. HIMG and the support that they have given to the hospitals in this community. Valley Health and the role that they play. Many other independent physicians and the employed physicians of both Cabell Huntington Hospital and St. Mary's. They have helped get to this point. Without our medical staffs working in conjunction with our hospital teams, you don't get in the top 5% in the nation in some of the quality scores that you have already achieved. And to see that commitment was another inspiring factor for me to come to a community where everybody is working together to ensure success. And I think the last thing that was really a driver on the decision of why we want to come to Huntington is we've been in a lot of communities, and I've competed in a lot of environments, and I'll tell you, I don't mind taking market share from competition. That's like a few of my favorite things to do in life, because that's what we do. As leaders of your organization, our duty is to represent the organization and to help it reach greater heights. But the fact that we had an exorbitant amount of effort, and Gary White, I'm going to steal one of your terms, a community built this health network. It wasn't done by just one group of people. It was everybody working together. It was the lawyers haggling it out and making sure it was appropriately structured. It is community members knocking on doors. It is elected officials saying we need to do this. And ultimately, it's the state saying, we're going to gamble on you, and we're going to watch what you do. And I would say that's okay, because we're going to deliver. And that's what we're supposed to do. So I wanted to say that sense of teamwork is something that you don't get to see in a lot of communities, but you have it here. And now we get to build upon it. So as we went through the decision process and I went through the interview process, one of the things that I thought would be a really good fit for me is I have a philosophy of partnerships. I've done a lot of joint ventures in my career. Some would say that I'm very pro-physician. Some would say I'm very pro-nursing because I married a nurse. But at the end of the day, the philosophy of partnerships were already here. Started long before I got here. Started long before Mountain Health was formed in each of the facilities. That philosophy and that partnership was already there, so that felt really good. And I think the last thing that was, I wanted to be all in, from the board's perspective, they were very, very intentional that we expect this health system to be top in the nation. Get in the top 5% in quality, and we're already there. In a lot of areas, we rank extraordinarily high. But this board was very specific in saying, we not only want to survive the turbulent waters of healthcare, we need to thrive, and we need to serve our community, and we need to be recognized, first of all, within our region, be a force in the state, contributing great things, and then be a force nationally. They were very clear, and I'm like, I'm in. That is the right vision, and that's the right place to go. So as we begin, I started my professional career in healthcare. The Army Reserves taught me how to be the world's worst X-ray technologist. I mastered that. Then I went to graduate school, and then I got involved in healthcare administration, and this is all I know. Working in healthcare and working with the people of healthcare, I know I have a bias, but they're the greatest people out there. Because people in healthcare will do things, they'll do the right things when no one's looking. And that's what we're going to be all about. And so I am very grateful for this warm reception. This is an outstanding turnout. I'm simply blown away, but now it's time to go to work. So I hope you enjoy the rest of the evening. Thank you for celebrating with us.